Cna Board Test Questions. Question 1. Which of the following is the most important reason for reporting changes in a resident's condition to the nurse? Option A. To document the change in the aide's daily notes. Option B. To protect the facility from liability. Option C. To prevent deterioration and provide timely intervention. Option D. To demonstrate that the aide is performing their duties. The correct answer is option C. To prevent deterioration and provide timely intervention. Early detection and reporting of changes, skin breakdown, behavior changes, decreased appetite, allows for rapid intervention and prevents further deterioration. Resident safety and well-being is the highest priority. Question 2. When providing oral care for an unconscious resident, the nurse aide should position the resident. Option A. Flat on the back with head slightly lowered. Option B. On the side, lateral position, with head turned to the side. Option C. Sitting upright at a 90-degree angle. Option D. Lying flat with the head of the bed elevated. The correct answer is option B. On the side, lateral position, with head turned to the side. The side-lying, lateral, position with head turned allows fluids to drain out of the mouth by gravity, preventing aspiration into the lungs. The aide should use a soft toothbrush or foam swab and minimal fluid. Question 3. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? Option A. Starting and 4. Option B. Applying oxygen. Option C. Obtaining blood gases. Option D. Medicating the patient for pain. The correct answer is option B. Applying oxygen. Burns to the face and neck compromise the airway due to potential inhalation injury and edema. Applying oxygen is the priority. For access and pain, medication follow after airway is secured. Question 4. The nurse aide is caring for a resident who has a stage 3 pressure ulcer on the coccyx. Which positioning aid is most appropriate? Option A. A doormat cushion. Option B. A rolled towel placed under the coccyx. Option C. A gel mattress overlay. Option D. A foam wedge under the knees. The correct answer is option C. A gel mattress overlay. Pressure redistribution surfaces like gel or foam mattress overlays reduce pressure on bony prominences. Doormat cushions are no longer recommended. They cause venous pooling and pressure at the doormat edges. Wedges under knees can be used but don't directly relieve sacral pressure. Question 5. A resident is on oxygen therapy via nasal cannula. The nurse aide notices that the tubing has become disconnected. What should the aide do first? Option A. Reconnect the tubing and check the flow rate. Option B. Turn off the oxygen completely. Option C. Remove the cannula from the resident's face. Option D. Call the nurse to fix the problem. The correct answer is option A. Reconnect the tubing and check the flow rate. Oxygen is a prescribed medication. The aide should immediately reconnect the tubing and verify the flow rate is at the prescribed level. Delaying action could cause hypoxia. The aide should then report the incident to the nurse. Question 6. A resident with a history of falls is getting out of bed without assistance. What should the nurse aide do first? Option A. Apply a vest restraint to prevent further attempts. Option B. Remind the resident to call for help and offer assistance. Option C. Report the incident to the charged nurse immediately. Option D. Lower all 4 side rails to prevent injury from climbing over. The correct answer is option B. Remind the resident to call for help and offer assistance. The least restrictive intervention should be attempted first. Reminding the resident to call for help and offering assistance respects the resident's rights while promoting safety. Restraints require a doctor's order and are a last resort. Question 7. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low roughage diet. Which food would have to be eliminated? Option A. Roasted chicken. Option B. Noodles. Option C. Cooked broccoli. Option D. Custard. The correct answer is option C. Cooked broccoli. Cooked broccoli is a high-fiber, roughage, food that should be avoided on a low roughage diet. Roughage foods increase bowel motility and can exacerbate diverticulitis symptoms. Question 8. When taking a resident's blood pressure, The nurse aide hears the first sound at 130 mm Hg and the last sound at 80 mm Hg. How should this be recorded? Option A, 130/80. Option B, 80/130. Option C, 130/50. Option D, 80/50. The correct answer is option A, 130/80. Blood pressure is recorded as systolic over diastolic. The first sound heard, Korokov phase I, is systolic pressure. The last sound heard, Korokov phase V, is diastolic pressure. 130/80 mm Hg is within normal range for many adults. Question 9. The practical nurse is adding tap water to several medications for administration via feeding tube. Which preparation should the nurse administer without delay? Option A, reconstituted powder. Option B, timed release capsule. Option C, cherry-flavored elixir. Option D, flavorless suspension. The correct answer is option A, reconstituted powder. Reconstituted antibiotics and other unstable medications must be administered promptly after mixing to maintain potency. Timed-release capsules should generally not be crushed or given via feeding tube unless specifically formulated. Question 10. While making an occupied bed, the nurse aide notices that the bottom sheet has a large tear. What should the aide do? Option A, smooth out the tear and continue making the bed. Option B, place the drawer sheet over the tear and continue. Option C, remove the torn sheet and replace it with a clean one. Option D, ignore the tear since it will be covered by the resident. The correct answer is option C, remove the torn sheet and replace it with a clean one. Torn linens can cause pressure points, skin breakdown, and discomfort. The torn sheet must be removed and replaced with a clean, wrinkle-free sheet to maintain skin integrity and resident comfort. Question 11. A client with cancer who has taken opioid analgesics for 2 years requires increased doses for pain relief. The client fears addiction. What information should the nurse provide? Option A, opioid use with cancer does not cause addiction. Option B, addiction is easily reversed if it occurs during pain management. Option C, prescribed opiates for cancer pain relief improve quality of life. Option D, opiate dosages can be tapered if a client fears addiction. The correct answer is option C, prescribed opiates for cancer pain relief improve quality of life. For cancer patients, opioid therapy focuses on pain management and quality of life. Tolerance, needing higher doses, is not addiction. Addiction is a psychological dependence characterized by loss of control and compulsive use, which is rare in cancer pain management. Question 12. What is the normal range for an adult's resting pulse rate? Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. Normal adult resting pulse is 60 to 100 beats per minute. Bradycardia is below 60, tachycardia is above 100. Both should be reported to the nurse, especially if accompanied by other symptoms. Question 13. A client with cancer refuses to allow an 4/4 chemotherapy and says she wants to go home to die. What is the priority nursing action? Option A, evaluate the client's mental status for competence. Option B, notify the healthcare provider for discharge orders. Option C, initiate a DNR order. Option D, document the refusal. The correct answer is option A, evaluate the client's mental status for competence. Competent clients have the right to refuse treatment. The nurse must first assess whether the client has decision-making capacity. If competent, the refusal is respected. Other actions follow based on competence determination. Question 14. A 4-year-old asks, will it hurt before tonsillectomy? What is the best response? Option A, it may hurt, but we'll give medicine to help. Option B, no, you won't feel anything. Option C, yes, it will hurt a lot. Option D, I don't know. The correct answer is option A, it may hurt, but we'll give medicine to help. Honest, developmentally appropriate, and reassuring responses build trust. Telling the child it may hurt but that medicine will help prepares them without causing excessive fear. False reassurance. B. Breaks trust when the child experiences pain. Question 15. The nurse is caring for a client receiving a continuous tube feeding. The gastric residual volume is 300 ml. What is the appropriate nursing action? Option A. Discard the residual and continue the feeding. Option B. Hold the feeding and notify the healthcare provider. Option C. Return the residual and slow the feeding rate. Option D. Flush the tube with 50 ml of water. The correct answer is option B. Hold the feeding and notify the healthcare provider. Large gastric residual volumes, typically 250-500 ml depending on policy, indicate delayed gastric emptying and increased aspiration risk. The nurse should hold the feeding and notify the provider for further orders. Question 16. Which intervention should the practical nurse implement to help a client cope effectively with chronic pain? Option A. Administer around-the-clock opiate drugs. Option B. Give scheduled doses of benzodiazepines. Option C. Recommend avoiding painful activities. Option D. Encourage using relaxation techniques. The correct answer is option D. Encourage using relaxation techniques. Non-pharmacologic interventions like relaxation techniques, distraction, and guided imagery help clients manage chronic pain and reduce reliance on medication. Avoiding activities leads to deconditioning, not improved coping. Question 17. During insertion of a nasogastric tube, NGT, into the right nares, the client starts to cough. Which action should the nurse implement? Option A. Notify the HCP of inability to insert the NGT. Option B. Flush the NGT with 30 ml of tap water to check patency. Option C. Withdraw NGT to the oropharynx, reposition the client's head, and reinsert. Option D. Continue placing the NGT because coughing is an expected response. The correct answer is option C. Withdraw NGT to the oropharynx, reposition the client's head, and reinsert. Coughing indicates the tube may be entering the trachea instead of the esophagus. The nurse should withdraw the tube to the oropharynx, flex the client's head forward, chin to chest, and attempt reinsertion. This closes the trachea and opens the esophagus. Question 18. A resident has a new onset of slurred speech and weakness on the right side. The nurse aide should: Option A. Help the resident walk to the bathroom. Option B. Give the resident a drink of water. Option C. Recognize these as signs of stroke and call for help immediately. Option D. Document the findings and monitor for changes. The correct answer is option C. Recognize these as signs of stroke and call for help immediately. Sudden onset of slurred speech and unilateral weakness are classic signs of stroke. Fast, face drooping, arm weakness, speech difficulty, time to call. This is a medical emergency requiring immediate intervention. Question 19. How often should a bedridden resident be repositioned to prevent pressure ulcers? Option A. Every 30 minutes. Option B. Every 2 hours. Option C. Every 4 hours. Option D. Every shift, 8 hours. The correct answer is option B. Every 2 hours. Bedridden residents should be repositioned at least every 2 hours, Q2H, to relieve pressure on bony prominences and prevent pressure ulcers. Repositioning schedules may be more frequent for high-risk residents. Question 20. A 6-month-old client is admitted with possible intussusception. Which question during the nursing history is least helpful? Option A. Tell me about his pain. Option B. What does his vomit look like? Option C. Describe his usual diet. Option D. Have you noticed changes in his abdominal size? The correct answer is option C. Describe his usual diet. Usual diet is not directly relevant to diagnosing intussusception, telescoping of the bowel, pain description, vomit characteristics, bilious is concerning, and abdominal changes are all directly relevant. Question 21. The nurse is assisting a client in planning a balanced vegetarian diet providing the highest protein quality. Which selection should the nurse recommend? Option A. Soybeans. Option B. Peanuts. Option C. Whole wheat. Option D. Sesame seeds. The correct answer is option A. Soybeans. Soybeans provide complete protein containing all essential amino acids. Plant proteins from peanuts, whole wheat, and sesame seeds are incomplete and should be combined to achieve complete protein profiles. Question 22. A resident has an order for a mechanical soft diet. Which food is appropriate to serve? Option A whole apple. Option B, scrambled eggs. Option C, a hard roll. Option D, whole kernel corn. The correct answer is option B, scrambled eggs. Mechanical soft diets include foods that are easy to chew and swallow, such as scrambled eggs, mashed potatoes, ground meat, and cooked cereals. Whole apples, hard rolls, and whole kernel corn require significant chewing. Question 23. An immobile elderly male has wet-sounding lungs, concentrated urine, and temperature 95.8 degrees Fahrenheit, 35.4 degrees Celsius. What nursing action is most important? Option A, turn the client every 2 hours. Option B, increase fluids. Option C, administer diuretics. Option D, encourage coughing. The correct answer is option A, turn the client every 2 hours. Wet-sounding lungs suggest fluid accumulation or pneumonia. Hypothermia, 95.8 degrees Fahrenheit, and concentrated urine indicate possible infection or metabolic issue. Turning the client every 2 hours mobilizes secretions, improves ventilation, and prevents further respiratory compromise. Question 24. A resident has a doctor's order for up with help of 1 UWH1. What does this mean? Option A, the resident is independent with mobility. Option B, the resident requires the assistance of one person to get up. Option C, the resident is bedridden and cannot get up. Option D, the resident needs a mechanical lift for transfers. The correct answer is option B, the resident requires the assistance of one person to get up. UWH1 is an abbreviation meaning the resident requires the assistance of one person to get up from bed or a chair. This is a transfer assistance level. The aide should follow the care plan and use proper body mechanics. Question 25. A client has rectal cancer and is scheduled for an abdominoperineal resection. What should be the priority nursing care during the post-operative period? Option A, teaching how to irrigate the ileostomy. Option B, stopping electrolyte loss in the incisional area. Option C, encouraging a high-fiber diet. Option D, facilitating perineal wound drainage. The correct answer is option D, facilitating perineal wound drainage. The perineal incision will have drains to facilitate wound drainage and prevent infection. Promoting drainage is the priority. The client will have a colostomy, not ileostomy.